Soon live. Well, hello everybody. Lee Blackall here again for the Teachers of Health Professionals. We're interviewing Professor Mark Gussy out at Bendigo, and he teaches a number of subjects plus the course coordination for oral health out there. We're talking about a subject that Mark has been developing called Evidence in Oral Health Practice. Did I get that right? A third year subject, Mark?
Evidence-based oral health practice, yes.
Evidence-based oral health practice. Thank you, Mark. And I happen to know that Mark has been experimenting a little bit with adjusting the written component of the assignment or the assessment work, sending them off into editing Wikipedia of all places. Gasp! Horror! Mark, what are you doing? Tell us about it.
It's been an interesting process. This is actually a new subject that's been developed this year, but I got interested in perhaps experimenting and being a little bit radical in terms of student assessments as a result of a previous subject where we used wiki sites and students constructed their own sites, and that was quite successful. So that sort of gave me confidence, I guess, to take further risks with this sort of technology. And in this subject, I've taken the lead from a number of academics in the United States in the health science areas, where they have actually built into their course exercises around assessment that use Wikipedia sites, and students have to go in there and basically construct the site in an evidence-based way. So in the United States, one of the guys there was saying that particularly with health information, there are many resource-poor settings around the world where healthcare professionals and consumers of healthcare need access to information, but the only access they have, of course, is via the internet. And Wikipedia is one of those sources that are out there that people can freely access and gain that information. But of course, and this is always where academics get a bit scared and anxious about Wikipedia, is the quality of that information is sometimes questioned. So the task that I sort of was thinking about was those sites are out there, the students use them themselves, and so do consumers of information about health. And so what I wanted the students to do was to be able to embrace those ideas, to accept that this is the way that normal people will access information, and so make it part of their professional responsibility to think about how they can improve the quality of that information to make it, when people do consume it, make it stuff that's effective and safe for them.
Oh, Mark, it wasn't so long ago that people would be calling that far too idealistic, and here you are doing it with your students. So congratulations. Can you show us maybe some of the work and tell us about how you approached it and the challenges and things? I'll prompt you as we go.
Okay. So you want me to...
Yeah, you share your screen and I'll talk over it while you work that out. Just if people are interested in that, we support teachers in developing this type of assessment practice here in the Faculty of Health at La Trobe University. We have run already a number of workshops, and we keep a page in Wikiversity called Professional Development for Teachers of Health Professionals, and you'll find through the links there examples such as Mark's. Mark, looks like you're ready to take us through here.
Yeah, so what I did, this is a capstone subject, so there are a number of generic sort of skills that we expect graduates to acquire before they complete the course, and part of that is teamwork. So what I did was construct groups of the students, about 4 or 5 students into groups. And then what I did was ran a workshop for them, and Lee was very helpful in coming and sharing with the students the skills that they required to be able to edit effectively Wikipedia sites. And I have to say right up front that I'm not an expert in Wikipedia or its construction or any of those sorts of things. And so I relied on Lee to give them just that basic generic skills, but I was also able to let the student, to have trust in the students that they would be able to in their group exploit the skills that they already had with relation to working with this sort of media. So I assigned each group a website which I had actually found on Wikipedia, and the websites I selected were ones that were poorly constructed, so there was very little content in those sites, and or there was information there that was not accurate or full or well referenced with evidence. So I did a bit of a scan and found some of these pages that had a dental flavour to them, and then I assigned them to the students. And basically the remit for students was to use their skills in being able to acquire and synthesize information from research, and then make it or transform it into a format which was able to be displayed on Wikipedia, and a format that was accessible for people who perhaps didn't have specialised knowledge in oral health as well.
And so I guess just if I can jump in there, people are always looking for what you're actually assessing here in terms of the formal parts of the core subject and its learning objectives. So this is evidence-based practice in oral health. I keep getting that name wrong, but essentially you've already sort of mentioned the types of skills you're wanting to assess in this process: accessing research literature on the topic, synthesizing pertinent points out of it, and then representing the information from that to a lay audience. That may not have been an objective, but that's the challenge that seems to test some of those objectives. Is that right? Am I on the right path there?
That's exactly right. And all of those skills are the implicit skills that we expect are developed in our students through their undergraduate programs. So, but the problem with, assessing or even sort of being able to determine whether students have achieved those sort of more generic competencies is really difficult for me as an educator. So this platform and the exercise the students have been through actually allow me to see that they are using those skills and that they are competent in those skills, whereas the more sort of conventional assessment pieces that I used to use didn't allow me to see that very well. So this has been really helpful for me to assure myself, but also for students to see themselves that they have met those competencies and are able to do those things.
So I think I know where you're going here. You're looking at an example page called Dental Emergency, and you're not actually looking at the page as it exists today. This is a page as it used to exist. So you're going to show us how, in fact, you could tell this this skill set was developing, I suppose. Right. Yes?
So this is one of the sites that I found, and I've taken it back to an old revision of this page. So at the beginning of the year, so the students basically started this project at the beginning of this year, and this is the website as it looked when they were assigned it. So you can see there's very little content in there. There's a lot of areas here where there's been statements that are unsubstantiated by evidence, and that required attention. You can see here the structure is very, very basic in terms of the subtitles and the areas that could be within this topic of dental emergency. So this is basically what they were given, and today this is what the page looks like. So you can see that as well as more content, they've had to look at the structuring in terms of subheadings. So they've had to take the information that they've found, synthesize it, and then make sense of it. And part of that making sense is structuring it into a format that is logical, and the sequence can be followed easily. So they have been through and determined what subheadings they were going to use, and then what was going to be included under each of those subheadings. Now, it's really also pleasing for me because some of the stuff that they're presenting here is actually a synthesis of the content of their course from previous subjects as well.
Oh, I see. Nice.
Yeah, so as a capstone, which we say is their ability to synthesize and bring together all of what they've learned, all the skills from from the different areas throughout their program into solving, problems. This is what I'm seeing them doing here. So it's really good like that. You can also see that they've got nicely referenced evidence there, and they've used the hyperlink function as well, of course, to take to other areas, which is a feature of Wikipedia as well. So very pleasing outcomes in terms of the content, but also, as I say, those generic competencies have been displayed through the way they've managed the site.
Can I just jump in and make an explanation too for viewers who are not familiar with Wikiversity? Is that every edit that is saved to a particular page is recorded in its revision history, and so Mark, you were able to access the original article before the student started working by going to the history tab at the top of any article, and then just scrolling through it development. So you can watch it develop real time, or you can obsess its development over a longer period of time by simply flicking through all of those revision histories.
Yeah, it's brilliant like that. And so, for me as an assessor, and particularly when you're looking at work that is done as a group, it's important to be able to assess contribution of individuals to that, and the view history, which is this function here, which Lee was just talking about.
Just hold on a minute, Mark. I'm not entirely sure that we're getting a clean feed through to the live broadcast here. Sometimes your screen goes black. I'm not sure if it's a bandwidth issue or if it's a signal issue, but we're seeing it now. So you've clicked the View History tab. Could you just point us to where you got that again at the top of the page?
Here at the top of the screen.
So just as you did, it went black. there you go. Okay. Just toward the top right-hand corner. Okay.
Okay, yeah. So what that allows me to do is to go through, and I can see here the nicks or the nicknames of the students who are contributing within this group, and I can basically assess the number of times they've accessed the page to make contributions, and I can also look at the nature of the contribution as well. So as well as the final product that's produced by the group, I can assess in this way the individual contributions that each student has made. And with traditional forms of group work, which are presented as a final sort of written or printed document, this aspect of the assessment is almost impossible to do. So I'm very pleased about this. And the other thing that I like about it is not only is it good for me, but I'm very explicit at the beginning of this process to the students that this is the way I will be assessing their individual contribution. And they're aware of that. So they're, it's a bit of a carrot, I suppose, to ensure that they do contribute consistently over time, not just making sporadic contributions of a lot of content at one point in time.
Mark, sorry to jump in there. Again, we've got a black screen, and we've had it for a while now, so I think we'll just stop sharing the screen and we'll just go into discussion mode, I'd say.
Okay, so let's go back here and unscreen share.
Yeah, thanks very much. Sorry about that screen trouble, but I think we did get just enough in that screen to see at least one example of your small groups of students improving one article. So how many students did you have, and so how many articles did you improve?
There were 5 groups, so we had about 25 students.
Yep.
So 5 of those pages have now been taken from very sort of basic, poorly structured pages to ones that now I think are of very good quality.
So when you did the first survey of Wikipedia articles to try and find candidates for improvement, how many pages do you think you saw relevant to oral health?
Oh, quite a lot. There were some pages that were well developed, but quite a significant amount. So I'm not going to run out of pages for students.
Yes. Unless, of course, all the other oral health teachers around the world see this remarkable video and jump on in. You're going to quickly run out, I guess. But I wonder where this could go,
Yeah, but the other nice thing, there's another function within the Wikipedia editing area that is called Talk.
Yes.
So for each page, Wikipedia page, there's a Talk function, and that's sort of like a bit of a forum where people can discuss what's occurring on the page proper itself. And so I asked the students to use that page themselves to have their discussions around their editing of the content. So that picked up a little bit more of the group work processes or dynamics that I was interested in that wouldn't have been reflected, for example, in that edit, that list of edits that occurred. So the student talk page, and I can't show you because we're having problems with the blank page, but that's where they would go and talk about what subheadings they would use collectively as a group. They were commenting on each other's edits themselves. And one of the really gratifying things was we actually had people external to the groups. For example, in the dental emergency one that I showed you, there was a dentist in the United States who was a bit of a Wikipedia editor, and he was actually in that talk forum congratulating the students on the work they were doing and what good quality it was, and that really gave the students a
big boost.
A big boost, yeah, and for me as well to have external people, not just myself, looking at their.
Yeah, so I find that many of the teachers I propose this to get quite anxious at the idea that anyone else can jump in on this, and in my experience it's largely been, not always, but largely been people who are legitimate contributors to the topic area.
That's right.
If not the topic area, then just the formatting and requirements of Wikipedia. So sometimes they're very challenging. So if the work's not very good or not to Wikipedia standards, they may even come in and start deleting people's work, and that can be very deflating. Yes. But in your case, it's quite remarkable too, because you've kept a very hands-off approach. You know, the support for the students doing this technical exercise has been quite minimal, and somehow you've managed to maintain their expectations enough to do a good job, and that things haven't kind of fallen off the rails with students complaining or all of that. Can you give us any insight on how you managed to pull that off, Mark?
Well, that's actually very pleasing, and I don't know how I pulled it off. I think it's the students' interaction with this technology. I've had nothing but good feedback from the students about how much they've enjoyed this process. They did express some concerns to me that other people could change their work or contribute in that way. And my approach was, that's what Wikipedia is about. But I will be able to see those changes. So the editing page allows me to see that. So even if someone did change or modify the work of the students, I was able to see that, they were able to see that, and then they had the ability to respond to that.
That's so, right. Yep.
Once they realised that, they were quite okay with it, and it's just been self-perpetuating, and that's the wonderful thing about it, is very little effort, as you say, had to go into keeping students on track, motivating them to contribute. It just seemed to take on a life of itself.
So I suppose then, for the uber cynic out there, then we must attribute something to the character of the types of students your course is attracting, that they driven like that, inspired by that, self-managed enough, and perhaps other courses have students that are less like that and kind of more uppity. What about, though, bringing it back a little bit to your marking workload and techniques? So you've got your standard ways marking an essay, which from my experience is just sheer overwhelming pain. But then there's this, you've got to click between edit history, discussion page. What did the marking workload look like in comparison to a standard way, and what sort of methods did you use?
Look, it was significantly reduced.
Reduced?
For me.
I'm surprised to hear that.
Well, it depends. I mean, it depends on the way you approach it. You could make it quite onerous and difficult for yourself, but it's about how confident you feel in letting go of those things that traditionally you would have had to, in your mind, maintain complete control over. So the final product speaks for itself, I think, but the capture of the history allows me at certain points to go in to see how things are going, to monitor. There were, in this particular group, no students who went completely AWOL, and I think that's because they're well aware of the expectations and the fact that Wikipedia is recording their contributions, and that that will be taken into account in terms of assessment. So the final product attracted part of the final mark, but so did the individual contribution of the student.
What sort of word count or workload allocation did you give for this in the subject?
There was 1 hour per week, which was allocated explicitly in the subject database for them. So
Okay.
that was explicitly. However, I do know that students have worked outside that hour voluntarily on this
Okay.
site.
Did you give it an equivalent word count? It's an odd way of measuring time and workload, I know, but did you do that?
There probably is one, but just off the top of my head, I can't remember what it is without looking at the subject database.
No worries. In combination with what other assessment methods did you use? So aside from Wikipedia altogether, did you do practical exams or what?
We had two other assessment pieces, and they were two assignments. One was a clinical case study, so this is a clinical course. So the students had to select a clinical scenario in a patient that they were caring for in the clinic, and apply and synthesize evidence around the management of that case. And then there was another larger assignment that was a evidence-based synthesis of information around a particular topic area. So sort of more conventional assessment pieces for those two things, but the three of those together were the total assessment of the subject.
Other questions are around what you expect the industry, so to speak, response to this method and skill set. So, for example, well, for one point is the external accreditors. If they see this method of assessment, will they take issue? Will you have to explain and defend it? What do you expect to happen there?
Well, we haven't had any comment from the external accreditors yet, but I'm quite confident that the explanation... I mean, the thing about these types of assessments is that they are authentic, and you cannot criticise what is a seemingly very authentic assessment. So, you know, my sense is that this is a very authentic assessment in terms of what the subject ILOs ask for, which is those capabilities that we talked about before. And also, Lee, we've also now got the La Trobe Essentials. And you know, those essentials really point towards this type of exercise using technology, which can be accessed globally. All of those things feed into it. So I feel very confident that any questions about this type of approach would be, you know, really able to be defended well.
And then focusing on the skills that are in the Wikipedia task, so not so much the skills that you're assessing out of the Wikipedia task, but the actual skill of editing Wikipedia and using that as an information generating source, etc. Can you see a time where your sector may actually value that skill set and it may give your students some sort of advantage in some workspace, or is that some way off?
Look, no, I don't think it's that far away. I gave a presentation recently where I was talking about my views of the future of dental and oral health education, and these are skills that I think will give the graduates that edge that they need. The world, and particularly in the dental environment, is becoming more competitive for students. So my sense is that these skills that they, at the moment, are picking up as they go along, may become defined as formal skills that we expect our students to acquire, because that's what they will need in order to compete effectively in the future. And it's not that far away.
So thanks very much for giving us this talk, Mark. I'm just going to get up to the page where people can go and get this recording. Let me just give me a tick, so I'm going to have to get it up and then share it. Because, Mark, the reason I want to point that out is just give me a little tick, is because where can we get the list of pages that your students have done and will probably continue to do in future years? So in Wikiversity, which is a so-called sister project to Wikipedia managed by the same organization, there is a page called Activities, Assignments and Assessment. And these interviews that we've been doing, several of them are recorded here in these examples of types of methods of assessment. And I guess we're parking yours under Edit Wikipedia, but there's so much more to it than that. But if we go into Edit Wikipedia, There's a couple of other examples, including a handout if you want to try running it. And here you are, Mark, evidence in oral health, and below you is coverage of health informatics, is another department that ran this in quite a different style to yours. The teacher felt like they needed to have a very solid grasp of Wikipedia before they were to take the students through it, but that teacher had a significant technical advantage, and he was able to come to terms with that very quickly. So what I'll do is I'll put your video just in here, and we'll list the pages that you've been working on there, if that's okay. So just to rehash that, that's Wikiversity. The page is Activities, Assignments and Assessment, which was a conference we ran last year, and we continue to get various interviews and examples in there. Mark Gussy, Professor Mark Gussy, thank you very much for meeting with us and giving us this recording.
No worries, thank you.
Okay, I'll just stop the broadcast, stay on the line there.